Yes, ma'am. I can start.
Okay, so you can start now.
Ma'am, here daughter name is Mrs.
Mrs.
Sandhu.
Andrew. Yes.
Okay. Okay. Hello, good morning.
Good morning.
I'm Dr. Irene, one of the attending doctor here today. Am I talking to Mrs. Andrew, daughter of Mr. Watkins?
Yes, doctor.
Mrs. Andrew, we are here to discuss regarding your father's health condition, and during our conversation, I'll write some notes which will be highly confidential. Is that okay with you?
Yes, it's fine with me.
So, Mrs. Andrew, do you want to attend any other person to our meeting?
No, doctor, I'm fine alone.
And Mrs. Andrew, do you take permission from your father to discuss regarding his health condition?
Yes, yes.
Okay. So, Mrs. Andrew, tell me uh, what is regarding your father condition? What is your how much do you know regarding your father condition?
Doctor, my father, he was having some chest pain and some, you can say, the racing of the heart. So he was not feeling well. So I just dropped him to the hospital yesterday, and I have to attend a very important meeting. So I went there. I just know that he was not feeling well.
Okay, understand, Mrs. Andrew. Yes, your father was admitted in our hospital due to palpitation, acceleration of the heartbeat, and we found it is called in medical term atrial fibrillation. That means the heartbeat is not palpate regularly; it's irregular. Okay, so it is medical term atrial fibrillation, and then imaging test of the heart. It is called echocardiogram, which reveal that your father's left side of the heart is called left ventricle have some dysfunction. Are you with me, Mrs. Andrew?
Yes, I am.
So, Mrs. Andrew, regarding your father's age and other physical status, that our consultant decided to improve the status of your father health. We have to start a medication. It's called anticoagulant. It's another name. It's just the blood thinning medication. Okay, so is irregular heartbeat which causes chance of increasing stroke. Are you with me, Mrs. Andrew? I'm explaining to you.
Yes, doctor, you are telling me that he is having some irregular heart rhythm, and now you are telling me that you are going to give him some blood thinners.
Blood, yes, because this irregular heartbeat is highly tendency of doing this blood clot. It could be in the brain, it could be in the heart also. Are you with me, Mrs. Andrew?
Okay, so you
So,
want to say that because
yeah.
of this irregular heartbeat, he can have some blood clot, right?
Yeah, in future
Okay.
it's a very emergency that it can cause this blood clot. It could be in the brain, it could be in the heart, or it could be in any blood channel over the body, Mrs. Andrew. So, our consultant advice for a blood thinning medication. It's called warfarin, Mrs. Andrew. Are you following me?
Yes, I am with you.
So this blood thinning medication, as your father still mentally capacitated and have mental capacity, and we discuss with your father regarding this drug, but he opposed to take this medication regarding this medication as need regular follow up weekly. So he denied to take this medication, Mrs. Andrew. Are you following me?
Sorry, doctor. You are saying that my father is not willing to take this medicine, and this is a
Yes,
very important medicine, right?
yes.
So,
We
doctor,
are.
please, I am his only daughter, right? And he's too old. He's 70, and he his memory is declining, and he cannot decide for himself, right? So I just wanted that you may start him on this blood thinning because it's in his benefit. He's not getting the point. Have you explained everything to him?
Mrs. Andrew, I appreciate that you are feeling. Mrs. Andrew, yes, our team of the doctor, try to convince him regarding medication, how important it is for the blood thinning to prevent the complication in future. And yes, it need in weekly test. It is a level of the blood we have to test every weekly. But he are not willing to take this medication. Another medication, it is called a simple medication. Also, it's a blood thinning. It's a not like warfarin blood thinning. It's a another medication name is aspirin. He asked, but if your father wish to take this medication, it's
No,
aspirin,
no, no, no,
not.
doctor. No, doctor. No, doctor. I think he's already old, right? And due to this heart problem, I think he's not capable of deciding for himself. And doctor, I just lost my mother, so I don't want to lose my father. You just start him on that superior blood thinning medicine, okay, so
I
that he may not suffer in the future.
really it is understandable to me that how you're feeling to your father. Really, it is appreciating your feelings for your father. But Mistress and your father telling that regarding frightened of a stroke, because he has tendency to falling down. So he's frightened of that, and he want to take medication aspirin as he has mentally
But
capable.
doctor, if he
And
does not take this medicine, he can have a stroke also, because you told
uh,
me that the clot will travel to the brain, so it would be the same thing. Either he takes or he not takes, but I think that taking the medicine is of more benefit.
yes, Mrs. Andrew, Ms. Andrew, your feelings really, I can feel if I am on your position, but as he's afraid of doing this weekly, falling down, and becoming any kind
No
of
problem,
bleeding.
doctor. No problem. I take the responsibility and I would be the one who will take for the test, right? I just showed you that I will take him to the hospital for the blood checkup regularly. So just start him on that medicine because I don't want to see my father suffering.
Mrs. Andrew, yes, I'm asking you a few questions. You wishing for best good health for your father, but now as your father has fully mental capacity and taking decision firmly, and right now his decision also very we have to take care of his decision. And yes, do you know that he has any lasting power of attorney? And again,
Yes,
do
doctor,
you
I
know?
am his lasting power of attorney.
Okay, and so it is the when if anyone lost the capacity of mentally, he can't take the decision. But right now,
So that is
you
why
will.
I'm deciding for himself. That is why I'm saying that he does not know that what is good for him, what is good, bad for him. So just start him on that medicine. He is appointing
Um,
me for his treatment.
Yeah, Mrs. Andrew, I understand. Really, it's understandable to me your feelings. That what we can do right now regarding your consent, regarding your wish, we can make a meeting with your father. Even you can talk with your father personally regarding this best medication that we are willing to give your father, and make him the consent regarding this medication and the benefit of this medication. And we can discuss the benefit of your father in front of your father. And if he agree, we can start this medication, Mrs. Andrea. Are you with me?
Okay, I'm with you. Okay, we will discuss it. But till then, I think that it's a very critical time, and you just start the medicine, then I will talk to him.
Mrs. Andrew, I really it's understandable that how you say you're feeling, but right now, without his consent, without his as he is fully mentally competent, we can't start this medication. But we started already medication is aspirin, but it's not so powerful as a warfarin, as I discussed with you. It also will prevent the complication. In the meanwhile, you can talk with your father regarding the benefit ratio, and if needed any kind of support, we are here to support of your father as he is afraid of Mrs. Andrew. Are you with me?
Yes, doctor.
So, Mrs. Andrew, with whom are your father living?
He lives alone. I
Uh,
live
so,
nearby him.
um, okay. So, Mrs. Andrew, if he afraid of any kind of any difficulty of working and doing any work in the home, if he need any kind of support of the home, there's a social health worker. They'll help you in this regard, Mrs. Andrew. Is that okay for social work support for your father?
Okay, 2 minutes remaining.
So, Mrs. Andrew, apart from this support, is there do he smoke, Mrs. Andrew?
No, he don't smoke.
And do you drink alcohol?
No,
Is any work he's doing right now, or he
no, he is retired.
okay, and he can take care of himself?
Yes, doctor. Previously, he was taking care of himself, and I used to pay daily visit to him.
Okay. So, Mrs. Andrew, right now, do you have any concern?
Yes, doctor. I have a concern. One of my friend's aunt, she was having the same problem, and doctor has started her on the medication. For that, she does not have to go for the frequent checkups. Can you start my father on that?
I appreciate really, it's really appreciating. Yes, there's a no medication, it's a new anticoagulation. Yes, this medication we can start. There's no need to feel a frequent checkup, but we can start. But we have to talk with our consultant also, and we can convince your father. You can talk with your father. There's another medication, same like we are suggesting for the warfarin, and the potency are the same, and no need to frequent checkup frequent for weekly checkup. So, but as he afraid of the falling down tendency, stroke tendency, you can discuss with your father. If he agree, we can start this medication also, Mrs. Andrew.
Okay, okay, doctor.
So, Mrs. Andrew, do you have any other concern?
No, thank you, doctor.
So, Mrs. Andrew, our meeting today, I want to summarize in details that your father was admitted in a hospital.
Your time is up, but you may continue.
That your father admitted due to the palpitation and we made the diagnosis at fibrillation and our echocardiography imaging test revealed that the dysfunction of the left ventricle, left side of the heart, and we want to start the warfarin medication. And your father is not willing to take this medication due to side effect of afraid of this bleeding on the hair brain. But if he gives the consent, we will start this medication. And another point of view regarding the another medication that you concern for the which no need to keep let's usually follow up. We'll discuss this issue also with our consultant. And so, Mrs. Andrew, I'll give some brochures leaflet regarding this anticoagulation medication. You can read more, and you can know the benefit and side effect of this medication,
Okay,
Mrs. Andrew.
okay,
Thank
thank
you,
you, doctor. Okay, thank you.
ma'am.
So, do you want to take 1 minute?
No, no, it's okay.
Okay, so what do you think how your scenario went?
I feel to convince. I tried to I tried to tell in details what actually happened after admission of the Mr. Watkins, her father, and what her father willing to take, and what is afraid of to being bleeding over the brain and weekly checkup. And I convey all information to his daughter, and his daughter is very willing to give this medication without concern even, as she has lasting power of attorney, and she can make a opinion in her behalf of her father. But as her father has fully mentally capacitated, so we have to take decision from her father.
Okay, so what are the ethical issues here?
Here, ethical issue is autonomy, though. Just right to know now, Mrs. Watkins' daughter here to know in details. We convey the messages. Beneficence. We will do the best for our patient, Mr. Watkins, that we want to start the anticoagulant medication. have warfarin or nuanced error anticoagulation medication. After convey the message, and we want to start with the consent of the father, with consent of Mr. Watson. Non-beneficial, we can't do any harm to the patient. Without we will without we have to start this medication, though if we don't start, it can cause in future stroke, instead of being stroke, clotting of the blood channel. So we don't want to do any harm to the patient. And adjustment
That is the
according.
beneficence. Starting the warfarin is the beneficence, right? So
Mm,
non-maleficence is
non-manifestation says do not harm to the patient. Do not harm to the patient means patient wishes that only taking the aspirin. So it is not acceptable from the patient only aspirin. So can't continue only aspirin also.
okay. And what is justice?
According to age 6, we'll give according to NHS exposed, we'll give best management of the patient.
Mhm. And what do you think that she was having the lasting power of attorney? So what do you think? Can she demand this for this treatment?
No, as also she has lasting power of attorney, but as her father has still mental capacity to take any kind of consent, right now it is not acceptable to take her decision.
Okay, so why you have discussed this lasting power of attorney here then?
Uh, okay. Though I think I asked this question, if any time her father loss of the mental capacity, if needed, any authority he has or not, that's point of view I just asked her.
Okay, right. So she mentioned about some other anticoagulation. What are your thoughts about that?
Nowadays, as we in practice in new onset or oral anticoagulation medication, we were also going to are practicing on instead of warfarin. There is most benefit rather than warfarin, and no need to quickly check up INR level. So we can discuss this issue with our consult level to start this new onset anticoagulation medication.
Okay, so that would be a decision of the cardiologist,
Yeah, that I say
right?
that we have to deal this. We will address this issue with our family the same.
Right. Okay. So we will discuss this scenario. First of all, I will point out you basically know what is the soul of the case. You know that she cannot demand the treatment and it is needed. And you also mentioned that he is not willing, so we cannot start. And what is the significance of starting this medication to decrease the risk of having the stroke, clot formation, right? And you also mentioned that in spite of that, patient is taking aspirin. So it does not mean that if he is not taking warfarin, so we are not giving any kind of treatment, but he's taking aspirin, right? So you know that what is the case about. So let's discuss that what are your mistakes. Then one by one, we will discuss that how to deal with that. You in this scenario, whenever do this scenario, you started rightly. As if I have done the case, I would say, I am Dr. Sadaf Hammad, one of the doctor taking care of your father. Are you Mrs. Andrew, daughter of Mr. Watkin? Then ask, are you next of kin to you? You forgot this next of kin today. Are you
Uh,
next of kin to him? Okay. So in the scenario, it is always almost given that you have suppose you have a permission to talk with the daughter. Okay, we have to take the permission from the father. We assume that we have taken the permission and you haven't set the agenda today. So after introduction, confirm the identity, consent to start the meeting. We are agenda. What is agenda here? Agenda is we are here to discuss about health problem of your father and the further management plan. Is that fine with you? So you forgot to set the agenda and you forgot to ask for next of kin here today, right?
mhm.
So tell the patient when she told that yes, he was having some chest pain and some heart rhythm problem. or racing of the heart, tell yes, you are right. When your father was brought here, he was complaining of some irregular heartbeat or some funny heartbeats or some racing of your heart. And at that time, we have done some tests, some electrical tracing of the heart and some jelly scans of the heart that show that he's having his heart is not pumping properly, right? And secondly, he's having some problem with the rhythm of the heart. We call it as atrial fibrillation. Here, if you want, you can draw the fourth chamber of the heart because there is left ventricular dysfunction also, and at the same time patient is having atrial fibrillation. Very rightly you said that in this condition there is some pooling of, because heart is not pumping properly, so there is some pooling of the blood that can cause the clot formation. And this clot can travel to anywhere. It can travel to brain, so patient can have the stroke. To prevent this, the heart doctor has decided to start your father on some blood thinning medicine, right? And one thing more, you are doing case very well, but there are two things. There were lack of empathy. Secondly, you have to don't do the case with a monotone. You have to change the tone, right?
Mm-hmm.
Because it is, we have to do the drama in the station 4.
Mm-hmm.
Give the information in small chunks. Do not do in paragraphs.
Mm-hmm.
That is why I had to interrupt you again and again. Give the information in small chunks, right?
Okay.
And yes, understanding you checked with the passage of time, just cut short your sentences. Okay, and at least 3 to 4 times in the station 4, do you have any concern? And do you have any questions? Although I kept on asking the question, but you have to say this word of concern. Okay,
Okay. Okay.
and there is no need to mention about the lasting power of attorney here, because if we are not going to consider it here, his father is competent, he's having capacity, and he's just doing fine. He's just having atrial fibrillation. So there is no need to discuss this. You
Mm-hmm.
discussed, he offered, and she offered, and you said, no, we will not listen to that. We will do that. So don't discuss LPA here. And LPA most of the time is decide about uh, the sort of treatment of withholding and starting the treatment. Here he has capacity, so he will not decide. You were very right here. Coming
Okay.
to the ethical issues, first one is autonomy, and autonomy here is patient has right to decide either he want to start the warfarin or not. So here it is not the next of kin has right to know about the condition. No, here autonomy is, we will say the patient has right to decide either he want to take anticoagulation therapy or not, although we have discussed the benefit and risk of starting and not starting the treatment. Okay, and then we will add that next of kin has a right to know about the health status and the decision of the his father, her father, sorry. Okay, and beneficence is starting the patient on the anticoagulation therapy, the warfarin, and when he refused, we started him on the aspirin. And involvement of the multidisciplinary team is the beneficence here. Non-beneficence is we cannot start the warfarin therapy against his will. That is the non-beneficence here. We will not start warfarin against his will. That is
So,
when we are not doing anything, that is
yeah.
non-maleficence.
So, ma'am,
Okay, we are
here
stopping.
active
Yes.
fibrillation, but the patient not willing to take warfarin, even without consent of the patient, we can't start warfarin, right, ma'am? So it's a
No,
non-beneficence.
yes, not starting the war. We will not start the warfarin against his will. He has refused, so we will not start. That is non-maleficence. And justice is that all the patients have equal rights to NHS resources, irrespective of age, gender, and ethnicity.
Yeah.
Okay, so
Yeah. Is there
that
any
is
legal
about the
issue?
yes.
Any legal issue in this case, ma'am?
Legal issue is about the capacity that patient has the right to decide for himself. Next of it cannot decide
Okay.
because patient is competent and has full capacity here. So when she was insisting that I want to that you do this, okay, so I really appreciate as you have done that you are quite concerned about your father. So, but we have discussed everything with him, and he has understood everything, and he has decided. You can ask that what are you concerned? You yourself told. So that is why I'm saying that give the information in the small chunks. You told that he's concerned about frequent visit and he's concerned about the brain stroke. Okay. So next you said I will in your presence we will arrange the meeting and discuss the issue. That was all the thing was right. Just be empathetic, short chunks, right? In this way too. Otherwise, you know the laws, you know the ethics, and you know the you can say body of the station 4. Agenda setting
So
is very important. It has marks.
regarding, as far I remember that I said that we are here to discuss regarding your health, father's health condition. And now, how much do you know? That way I
Okay,
just,
okay, that's right. If you have done this, that is wonderful.
I asked this way, how much do you know? So I can say we are here the your father condition. Then I can start, but I just say how much do you know? That's where I just started.
Yes, okay, right.
Okay. So, ma'am, regarding in the last, what was my performance regarding social support? If
Hmm.
her father need any kind of support doing activity, is that okay?
Hmm.
I mean, regarding the smoking, alcohol support, social support, is that an ending? What was my ending?
First thing is in the station 4, the patient summarizes, right? In history, we summarize, we recap. In station 4, patient summarizes. But during this conversation, I summarized time to time. So there was no need to do the recap at the end. So social history here is that how he was doing. Do you need any kind of support? If he needed, we can offer. If patient has capacity, or I think there is no need to ask for. If it is not relevant, patient has capacity, we can discuss this issue with him about
No.
the smoking.
Okay. So no need to raise this issue, smoking alcohol in this case, as he has a capacity.
There are different thoughts. Some uh, the tutors they say that ask these questions, but I don't think so, because everything is about confidentiality. He's 70-year old. The patient is competent. He has capacity. He just have atrial fibrillation, right? So we can discuss that issue with him. We are just here to inform the decision of his father to the daughter, right? That he has decided this. So at any time, maybe the patient or the patient's family raises a concern that why don't you have started him. So we have taken the family in confidence that it is their father's decision, but time to time we will keep on checking with him if he insists, he agrees for that. And secondly, we assured that we have started on some other clot buster. Aspirin is basically the clot buster medicine. Okay.
But here,
And
here is mentioned that he has made an informed decision not to undertake this and to remain on aspirin. So we start aspirin, right? In this case, patient
yes,
on so patient we discussed this issue regarding the warfarin, but the father wishes to not to take warfarin. Patient
yes,
father wishes to continue this aspirin, right? Ma'am?
yes, yes, yes.
Okay,
Okay, but we
understand.
are informing the daughter about his father's decision.
Okay. Okay.
Okay.
Okay,
So
understand.
there were one more question about the Novak. So here we can say yes, there are other options available. We'll discuss with the heart doctor. If he thinks that is suitable for father, we will discuss this issue in the next meeting, or after discussing with the heart doctor, we can start, because there is no contraindication. It is contraindicated in valvular atrial fibrillation, right? It is non-valvular, so we can start. But with the help
Okay.
of the consultant, will decide. The cardiologist will decide.
Okay. Okay.
In this, he need to stop driving. But those issue, no need to go in detail, right? That issues
Okay.
can be talked with the
Okay.
father.
Okay.
So your main mistake was about the advanced active in LPA, because it's not a terminal case.
Okay.
So
So
any question regarding this
how
case? Yes,
so I mean how will be my mark regarding it be failing mark? How will be the mark in 16?
I have cut
Uh,
your marks in To be honest, I was a strict one today, so I gave you borderline in the concern
Mm-hmm.
because you kept on talking. I had to interrupt you. So you have to
Mm-hmm.
listen to the patient and let the patient ask the question and then answer, right?
Mm-hmm.
And borderline in the clinical judgment because you involve the LPA.
Okay. Okay. Understand. Now understand.
Okay. And clinical judgment also because your these ethical issues were not right. Autonomy is patient can refuse or accept any given treatment. So that is autonomy, not the next of kin has right to know. We can add that, but main is the patient can refuse or accept any treatment. And
Mm-hmm.
beneficence, you told wrong. So that is why clinical judgment I have given you borderline.
Mm-hmm.
Okay. So it is 12 out of 16.
Okay.
In history, it was 16 out of 20 because you lost
Okay.
the differential
Yeah.
diagnosis.
It is, yeah.